Hello. Hello,
Yes.
Dr. Deshmukh. Yes. Dr. Deshmukh, please start.
Yes, UTV started. You can start. Proceed.
Good morning, everyone. And on the basis of the Riyat and Bahara Dental College, Mohali, we are presenting today the role of the microbes on the dental caries. And I'm giving this honor to introduce our speaker and our patrons to Dr. Mandeep Kumar. So, Dr. Mandeep, please kindly take off the stage.
Good morning, everyone. Thank you, Dr. Inam, for making us join. Good morning, everyone. Myself, Dr. Mandeep, Professor and Head of Prosthodontics, welcomes you all to the international panel discussion on current trends on controlling dental microbes in collaboration with Riyadh Dental College and Hospital and Microbiologist Society, India. We are very thankful to Dr. Swaranjit Singh, Director of Microbiologist Society, India, Dr. Neena Mehta, Dean Academics RBU, Dr. Vimal Kalia, Principal, Riyadh Dental College and Hospital, for helping us and guiding us to organize this event. Dear participants, our guest speaker for today's discussion are Dr. Ina Sharma for introduction of dental caries, Dr. Alka for telling us about the microbiology of dental caries, Dr. Anuva for preventive and prevention of dental caries, Dr. Jyotsna for oral hygiene management. I would like to invite Dr. Ina Sharma for starting this event on introduction of dental caries.
Okay, before that, I invite Dr. Deshmukh, President of MBSI, to say a few words to us. Dr. Deshmukh.
Yes, thank you. Thank you very much. Thank you, sir, for calling me. I'm very happy today that Dr. Swarnajit Singh and the team from Dental College has organized a beautiful event regarding health of human being. And Microbiologist Society, India, is supporting, is inspiring all these young scientists, young academicians, and this lecture is recorded. As it is recorded, it will be circulated throughout India. At the beginning only, I will thanks all for organizing this event and discussing very important issue of the health. Thank you very much.
Okay, thank you very much, Dr. Deshmukh, for the encouragement which you always give us. You inspire us all the time. I will give a brief overview of dental health, mouth hygiene, a small overview, and then Ina can take over. There are both good and bad microbes in our mouth. Some are beneficial, while others are very pathogenic. Some toothpaste have beneficial bacteria in them, and they are available in the market. A common example of bad bacteria is Streptococcus mutans. This is the most common example of bad bacteria in our mouth that causes tooth decay. As mutants sticks to the surface of the teeth produces an aggressive acid that breaks down the enamel. It is very damaging to the teeth enamel. It is reported that Lactobacillus anticaries, which is a probiotic microbe found in curd and yogurt, can be used to prevent tooth decay caused by the bad bacteria. Very soon, we will have many toothpastes, chewing gums, which we chew in our mouth, and mouthwashes with probiotic bacteria. Some best examples of probiotics for cavities is Lactobacillus acidophilus, Lactobacillus paracisi, Lactobacillus rhamnosus, Lactobacillus kisai, Lactobacillus salivarius. This is available in the saliva and on the tongue. We have Streptococcus thermophilus, which can grow above 45 degrees centigrade. Then we have Bifidobacillus, which is also very good probiotic, which can be used in the toothpaste, chewing gums, and also in the mouthwash. Enzymes like lysozyme and lactoferrin help in the removal of bacterial and yeast biofilms on our teeth, on our tongue, and we are free from the pathogens in the mouth. Currently, antibacterial chemical known as Triclosan. Triclosan is a chemical which is widely used in toothpaste for killing bacteria in the mouth. This chemical leads to an opposite effect. It leads to a bad effect, this chemical. So we have to replace these chemicals with actually probiotic bacteria. And it renders antibiotics less effective for treatment. If you give antibiotics for the treatment of the gums and teeth, it is less effective because of this chemical triclosan. The oral microbiome, microbiome is in our stomach, microbiome is on our skin, on the hands, on the mouth, on the face, okay? And these microbiomes are very, very useful to humans. And we have healthy bacteria and balanced bacteria with the pathogens. Good bacteria boosting toothpaste is Zendium. Zendium is a very good toothpaste which has probiotic bacteria. So we should eat plants and vegetable-based foods. We should cut down sugars in our diet. Quit smoking. Smoking is very bad for the mouth microbes. So we should quit smoking. It is also carcinogenic. And we have to manage our blood glucose, and we must use fibrous foods for our diet. This is just a short overview which the doctors of the dental college and hospital will share with you in details. Over to the presentation, please.
Thank you so much, Dr. Swaranjit Singh and Dr. Arvind Deshmukh for organizing and enlighten us to organize such a beautiful event. And so I myself, Dr. Ina Sharma, will be starting with the introduction to what are the dental caries, their definition and the classification on which they are organized. So what is the first of all, what are the dental caries? So dental caries, basically, the caries itself is derived from another Latin word that is a rot or a decay. And itself says, and in a Greek word, it is means a death. So what is they are? They are the progressive lesions which initially surface the demineralization of the teeth by the bacterial acids, or we can say by the bacterial actions. One of the most common disease of the mouth is the dental caries. And the major cause of the loss of the tooth also is the dental caries, and the dental caries can if it enhances into the pulp cavity, then it can lead to a severe pain, which is the third most dreaded pain seen after the MI and the labor pain. Coming further, we have a definition which are given by the various scientists and according to the WHO. Now, what the scientist Student has said that the dental caries in an infectious microbiological disease of the tooth that result in localized dissolution and destruction of the calcified tissues. The calcified tissues are present in the teeth are enamel, dentine. So they lead to the dissolution and destruction of these tissues. And according to the WHO, the World Health Organization, they defined it as a localized post-eruptive pathological process of external origin involving softening of the hard tissue and proceeding formation to the cavity. Now, coming to further, another definition which was given by Schaeffer, and the dental caries in an irreversible microbiological disease. So one of the most important point is that it is irreversible. Once it has happened, it cannot be reversed of the calcified tissue and characterized by demineralization of an inorganic portion and destruction of an organic substance of the tooth, which often leads to the cavitation. And according to Miller's, the dental decay is a chemoparasitic process. Now, it is when the chemical, the bacterial acids, and their parasitic process consisting of the two stages. One is the decalcification or the softening of the tissue and dilution of the softened residue. We are coming forward with a various classification and how these dental caries has been classified, which help us in prevention of these dental caries, which help us in conservative treatment, which help us in restoration of these dental caries, and which help us in prevention of this further caries into the pulpal tissues. Now, the recent classification, which is given by the Journal of American Dental Association in June 2022, the classification based on the treatment of the dental caries, morphology of the lesion, prior condition of the tooth, severity and the role of the tooth, and extent of the lesion, chronology or the age, etiology, and affected tissue. Now, one is what is coming to the treatment of the dental caries. Now, how the dental caries can be treated and how we can classify this. First is the DMFT, which we all know that the decayed or the carious lesion, missing and filled restoration. Missing tooth or the filled, or it can be restored or the filled with any filling material. Coming to the morphology, morphology is based on the location of the lesion. It is on the occlusion surface or on the smooth surface caries or on the root caries. Then the prior condition of the tooth, primary or the secondary caries. Now, primary caries they are the recurrent caries. Once we have restored the tooth, again the caries has happened in that area due to the seepage of the microflora. Then severity and the rate of the caries progression, acute, chronic, active, and arrested caries. Extent of the lesion, incipient caries or the advanced caries. Chronology or the age, it can be based on the early childhood caries, adolescent caries, or the adult caries. Then etiology, what are the causes or the region of the caries? In this classification, it can cover as a baby bottle tooth decay. And affected tissues, based on that, it can affect the enamel, dentine, cementum, or the pulpal tissues. But there are various classifications which are based on that. These caries has been defined. One of the most important classification that is given by the GB Black, which usually we follow, and this is given in 1900, and the system is very easier to use, but it does not involve the non-carious lesions, and they are basically divide the caries based on the side of the tooth. Then further, the WHO has given the classification which prevents the prevalence of a person as a which a person can get the caries. Then coming up to the international caries detection and the assessment system, which supports that the clinical scoring system designed to lead a better quality information and to provide a framework to support and personal total caries management to improve a long-term health outcome. Then coming up, American Dental Association, which also involves the classification of caries, the entire range of caries as a disease progress and its effects on the patient care. It seeks on a balance of data collection needs and the time limitation of practicing dentists with the need of scientifically accurate data differentiation for use in clinical caries management system. So basically, how we can manage the caries lesion in the clinical system. Then Mount Hume classification, this system defines the extent and the complexity of the caries lesion. At the same time, encourages a conservative approach, how conservatively we can preserve the tooth. And it can also provide some guidance regarding the choice of the restorative material, which material can be beneficial if we restore the tooth with that. Then site stage caries classification system. This is also similar to Mount Hume system. It is dependent upon the site component and the stage component of the caries lesion and provides some guidance regarding the choice of the restorative material. Then coming to the caries assessment spectrum treatment index. This comprehensive and pragmatic hierarchical caries assessment index describing the complete range of stages of the caries progression, that how the caries are first enter in the enamel, then in the dentine, and then in the cementum or on the pulpal tissues. Now, first important classification, which is given by G.B. Black in 1900 and which we usually follow these days. This is first is the class 1 caries. So class 1 caries, these caries are affecting mainly on the patent fissure of the occlusion surfaces of the posterior teeth and on the lingual part of the anterior tooth. These are the class 1 caries. Now, when we classify further into the class 2, these are the class 2 which caries affecting the proximal surfaces of the posterior teeth. Okay? So the mesial or the distal surfaces of the posterior teeth or the buccolingual. Okay, so class 3 is the caries affecting the proximal surface of the central incisor and the lateral incisor and the cuspid, but without involving the incisor edge. Whereas in the class 4, the caries affecting the proximal surface, including the proximal edge, which you can see clearly in the diagram. And then coming to the class 5, the class 5, the caries affecting the gingival third. So gingival third, this is which we call as a gingival third part of the crown or the cervical part of the crown. So caries affected in these parts, they are considering into the class 5. And class 6, the caries affecting the cusp tip of the molars, premolar or the cusp. So basically they are just affecting on the cusp tips. So these are the classification. Now further, according to the major classification which is given by the Nicky Ford in 1985 based on the morphology, dynamics and chronologically. Morphologically based on the where particular sites they are present. Now in type 1, they are present on the patent fissure or the occlusion surface. As you can see in the diagram, they are present on the patent fissures or on the occlusion surface. And these are basically present on the irregular surface because the mechanically we cannot clear the debris or the plaque over the surface. So this usually occur early in life before the smooth surface lesion. Then coming to the type 2, which are the smooth surface lesion. The smooth surface, they are presently basically interproximal, that is in between the two tooth cervical areas or on the gingival, near the gingival third or cervical third of the tooth. Then coming to the root or the cementum caries, as the name itself defines that the root, so they are present on the root surface of the tooth. These caries initiates at the dentinal root portion of the tooth, predominantly found in the dentition of the older age group with significant gingival recession and exposed tooth surface, and initiates on the mineralization of cementum and dentine surface, which have a greater organic compounds than the enamel. Therefore, the bacterial flora causing the root caries may be different from the flora that the enamel caries. Coming to the another classification based on the severity and the rate of progression of the lesion. Now, as we know that the class 1 severity of the lesion, they are very mild and they are basically seen on the molars, and class 2 mild caries, ordinary caries basically seen on the occlusion pits and the contacts area and on the molar area, and class 3 moderate caries, which is seen on the premolar and the molar area and on the occlusion and the proximal buccal and lingual pit, and class 4 severe caries, which are present almost on all the tooth, including the anterior and the posterior and proximal surface and the lingual pits also. And class 5, they are the very serious and the rampant caries. They can be seen, rampant means recurrence, and they are totally present on the all of the tooth, and they are presently on the proximal of the anteriors and the cervical area of almost all the anteriors and posteriors. Now, what are the rampant caries? They are suddenly appearing. Rampant caries are, they are suddenly appearing widespread, widely separated in the mouth, and rapidly burrowing type of the caries, resulting in early involvement of the pulp and affecting those teeth that are usually regarded as immune to ordinary. So these caries, they affected all the tooth which we always regard the caries cannot happen in that particular tooth, but these rampant caries can happen on the tooth, and the surfaces involved are proximal and the cervical. Caries increment of 10 or more new carious lesion over a period of time can be clearly called as a rampant caries, and the major causes can be the dietary factors or the oral flora or the physiological factors of the saliva. Coming to the incipient caries name shows that it is an earlier caries lesion and clinically manifested either as a white and opaque lesion. And at this stage, only chemical damage and loss of mineral salt has been occurred in the enamel. There is no significant penetration of bacteria associated with dentinal lesion, cavitation, and no major histological change of the organic matrix of the enamel has been seen in these lesions. The important feature of this incipient caries are apparently intact surface layer overlying the subsurface demineralization. And if the intact surface becomes pigmented because of the absorption of this external stain, this can be called as a brown stains. Coming to the arrested caries, the clinical evidence always show that the incipient or even the more advanced carious lesion may become arrested. May the bacterial growth or the bacterial acid which can cause the caries can stop their work and it become arrested. And if there is a shift from these oral condition from predisposed to that type to the slower caries process. Clinical feature is marked brown in duration or pigmentation of the lesion. Coming to the recurrent caries, and there's a recurrent caries as the name suggests that this is basically happen when there is a already restoration has been done, but there is a micro seepage or the leakage of the microflora in that particular restorative area after so many years of the restoration, which can lead to the recurrent caries. They indicate usually unusual susceptibility to the caries, poor cavity preparation, or defective restoration. Then coming to the xerostomia introduced, as xerostomia, we all know that the condition where there is less saliva is there, saliva flow has been reduced due to various reasons. One of the major reason is radiation. So this can lead to the shift from the microflora. So this can lead to a carious lesion, and patient carious lesion usually reappear in the patient who has undergone radiation therapy and lead to the outset of the xerostomia, and this xerostomia lead to the change in the shift of the microflora, and hence the full mouth carious lesion has been observed. Now coming to the classification based on the morphology. So one of the main caries which have been we are seeing in our pediatrics patient or in pedo patients, they are the infancy or the nursing bottle caries. They are described as a rapidly progressive type of caries that affect the primary teeth of the children during the first 2 years. And these type of caries has been seen in the children who are completely on the bottle feed on during the night or even in the day. So this leads to the plaque accumulation on that particular teeth. Basically, the anterior first 4 maxillary incisors are mainly involved in this, and due to their anatomic position, and this leads to this decay in this infants or the toddlers. Initially, lower anterior teeth may not be involved because of the protective environment of the mandibular salivary secretion and cleansing action of the tongue muscles. But later on, if the unusual diet history or the pacifiers or honey or the complete bottle feed has been given to the toddler, this can lead to a further bottle baby caries in the toddlers. Now coming to the adolescence as the age revealed, it is from the 11 to 18 years of the age. And these are the characteristics of the lesions in the teeth and the surface are relatively immune to caries. Relatively small opening in the enamel with extensive undermine of the enamel. Rapid penetration of the enamel and extensive involvement of the dentine. Rapid progression of the lesion which does not permit an effective pulpal response with little or no secondary dentine. So these are the basically classification of the dental caries, and the adolescent caries, they basically due to the bad habits or non-maintaining the oral hygiene has been seen in the adolescent patients. Now I will definitely call Dr. Alka for further communication of and enhancing us with the knowledge of the etiology and the microbiological involvement of the dental caries.
Hello, Dr. Swarnaji Singh. Hello, sir. Hello. Hello. Can you listen me? Hello. Can
Hello.
you listen me, sir? Can you listen
Yes,
me?
I can. I can.
Sir, let me tell you,
Yes.
Dr. Anjana Singh,
Yes.
she is a professor and head from Tribhuvan University, Nepal.
All right.
She has joined.
Very nice. Very nice.
Yeah. And she is a very, she has a very good scientific work
Okay.
in Asia.
All right.
So she has just joined. I welcome her.
Welcome. Welcome, madam.
Sir? Thank you, sir.
Yes.
I was interested, so I also joined today. Thank you so
Yeah.
much.
Welcome.
You are most welcome.
Thank you, sir. Thank you.
So the conference has become international. The panel discussion is now international.
Yes.
Yes. Okay, please present.
I have made co-host to Alka ma'am.
Good morning, everyone. Good morning, everyone.
Seriously?
Alka ma'am can share the slide.
Good morning, everyone. Myself, Dr. Alka Bhardwaj. I am here to discuss the role of microbes in dental caries. As Dr. Ina said, the caries, the word derives from the Latin word which means rot or rotten. WHO declares that deprived oral health and its related diseases may have dreadful effect on common health as well as eminence of life. Dental caries is common and major public health oral disease. During last few decades, the incidence of microbial diseases has amplified drastically, and microorganisms, they are superbug agent which are responsible for the dental caries. Now coming to the theories of the dental caries. In the history of caries, various theories were proposed and specified for the cause of the dental caries. The earlier theories was the legend of worms, which proposed that the worms were responsible for the caries. Next come the theories, which is humoral theory, which proposed that blood, bile, they are responsible factor for the caries. Next come the vital theory, which state that the caries, they arise from the within the tooth, like the gangrene. But the main theory, which is mostly accepted, is the Miller's chemoparasitic theory or acetogenic theory, which state that caries is caused by acids which are produced by the microorganisms of the mouth. Now, how they produce and how they cause caries, microorganisms, they transform sugars to acids in the process of fermentation, which cause decay to the hard structures and soft tissues of the mouth. The Miller's theory, it is most acceptable one. The Miller's the theory, it states that the factors which cause decay to the teeth are host and teeth, carbohydrates, microflora, and time, like host and teeth. Now, implantation of the microorganisms can only occur when teeth are present. Teeth provide non-shedding surface of colonization of the microorganisms. Then substrate. Substrate here is fermentable carbohydrates. Now, carbohydrates, the formation of the caries, it is associated with the carbohydrate content of the diet. Now, how? The microorganisms, for example, the Streptococcus mutans, it utilizes carbohydrates and form organic acids which demineralize the teeth. The next is microflora, which is etiological factor for the caries. Microorganisms, they are responsible for the dental caries. Streptococcus mutans, it is mostly responsible for the caries. It is also known as the early colonizers that interfere with directly with the salivary proteins. Next one is time. Time is also a significant factor in progression of caries. Because frequency of contact of substrate, it has major role in karyogenicity. Now, this is the mechanism how microorganisms cause caries. So, there is susceptible tooth surface. First, biofilm is formed and microbes deposit there. And then microbes, they produce acid and there is pH change. We call 5.5 pH as critical pH. Below the critical pH, demineralization occurs. The environment changes into acidic environment. There is shift in dynamic equilibrium of the minerals, and then dissolution of minerals occurs, which initiate the caries. Now, formation of plaque. The initial phase is the pellicle development. Then bacterial adhesion occurs, and later on microbial colonization. Now, what is biofilm and how it is formed? The first step is the pellicle formation. Now, I want to introduce the term biofilm. The oral biofilm, they are one of the most complex and diverse ecosystem developed by the successive colonization of more than 600 bacteria species. So, how the biofilm form? First step is the pellicle formation. Pellicle, it is a thin film derived from the salivary glycoproteins which are attached to the clean tooth surface. Then the next step is the initial adhesion. In this, pioneer bacteria in saliva, they recognize the binding proteins in acquired pellicle and attach to them. The next step is the maturation. Different bacterial species, they co-aggregate and mature biofilms form. The last one is the dispersion. Bacteria disperse from the biofilm surface and spread to colonize a new site. This is a picture showing bacterial colonization. Here we can see the early colonizers and late colonizers. The microbial accumulation that adhere to the surface shows structural organization partly due to the organic matrix derived salivary glycoproteins and extracellular microbial products. This accumulation is broadly classified into supragingival and subgingival biofilm. Above the gingiva, it is known as supragingival biofilm, and below the gingiva, it is known as subgingival biofilm. So development cycle starts with the attachment of early colonizers. The bacteria which are early colonizers are actinomyces species and oral streptococci on acquired pellicle and tooth enamel. These bacteria not only adhere to tooth surface but also interact with each other and lay foundation for attachment of bridging colonizer such as Fusobacterium nucleatum, followed by the late colonizers, which include the Porphyromonas gingivalis, Treponema denticola species, which are the founders of the periodontal disease. So early colonizers, basically the early colonizers are the actinomyces species and the oral streptococci. 80% are the streptococci species which are responsible for the caries. Now, acidogenicity of the streptococcus mutans. The S mutants, they produce lactate, formate, acetate, and ethanol as the fermentation products. The acidogenicity of the mutants lead to ecological changes in the plant flora. That includes an elevation in the proportion of mutants and other acidogenesis and acid-tolerant species. These are the species of the streptococcus which are mostly found in the caries. So Streptococcus mutans group, Streptococcus salivarius group, Streptococcus mitis group, Streptococcus sanguinis group, Streptococcus angelus group. So the term is co-aggregation. What is co-aggregation? Co-aggregation is basically the ability of different species and genera of biofilm microorganisms to adhere to one another, and this is known as co-aggregation. So next is microbial diagnosis. Why microbial diagnosis is important and caries? Because what is the significance? Because the measure of degree to which the local environment challenge favors the possibility of the caries test. It establish an initial base level of the cariogenic pathogens as basis of future evaluation and preventive dentistry counseling. And the next, which is common, is antibiotic susceptibility tests. Now, antibiotic resistance is very common. We unnecessarily take antibiotics, or we unnecessarily give antibiotics to the patients, which later on cause antibiotic resistance. So the next antibiotics, the patient, it become resistant to the antibiotics, and antibiotics does not act on the body. So the significance is the increased bacterial resistance to antibiotics currently used in dentistry has a great importance for the prevention of oral bacterial growth, adhesion, and colonization. So it is extremely important to increase the knowledge towards their mechanism, focusing on prevention and the correct therapeutic approaches fully involve decreasing the growth of S mutants and other cariogenic bacteria. And it also provides the knowledge of the microbes. It also provides us to design a new treatment for chronic infectious diseases. Thank you. Thank you very much. Now, Dr. Anuva will come forward and discuss preventive measures for the caries. Thank you so much.
Good morning, sir. Sir, I think you need to make me a co-host if I want to share the screen.
Can you share the screen?
No, sir. Not right now.
Are you in the hospital? Where are you?
No, sir. I'm not at the hospital, sir. I'm at home, sir.
Okay. Oh, then I will. What is your name? Full name?
Sir, Dr. Anuva Bhardwaj.
Anuva.
Yes, yes, sir.
Then I have to, let me see if I can do it. Otherwise, I'll call Deshmukh.
Okay, sir.
1 minute. Dr. Deshmukh? Hello? Dr. Deshmukh?
Hello.
Dr. Deshmukh?
I will make you host. I will make you
Hello?
I am making you host.
Doctor,
Okay, sir.
please share the screen with, what is your name? Anu?
Anuva, sir. Anuva Bhardwaj.
Anua Bhartwaj.
Yes, sir.
Share the screen. Anua Bhartwaj.
Yes, sir.
Now you are host.
Okay, sir. I'll just check.
Swarnaji Singh sir
Check.
is host.
Sir, it's still not sharing. So Dr. Ina is coming as co-host. I'm not coming as a co-host.
And where is Nina?
Dr. Ina is at the hospital. She's coming as the co-host. I'm not coming as the co-host.
Wait. Can you again say Dr. Deshmukh and your name? Say Dr. Deshmukh and your name.
Sir, my name is Dr. Anuva Bhardwaj.
Dr. Arvind, Anua Bhartwaj is a speaker. Please make her co-host. Anua Bhartwaj.
Sir, you are host now.
Okay, then I will try to do. Hello, Dr. Dr. Deshmukh.
Yes, sir.
Please make Anua Bhartwaj speaker the host, co-host. Anua Bhartwaj.
You are host now. Sir, you are host now. Sir, you are host now.
No, okay, but you also make Anua Bhartwaj host. Anua Bhartwaj.
You can make, I cannot make. You can make, I cannot make.
Okay.
स्वरंजीत सर, आपके परमिशन से एक बात कहूं मैं?
हाँ, बोलिए.
धन्यवाद. Dr. Deshmukh, good morning, everyone. Dental issue. It is said that if you are brushing your teeth, you are not only brushing your teeth, you are brushing your coronary arteries also. It has been found out that the coronary arteries, the microbes responsible for the plaques formation in the coronary arteries are somehow related with the microbes found in the mouth. So that's very important. And one of my research scholars, with PhD under me, Dr. Priti Prasad is an assistant professor. She produced one herbal mouthwash, and one dentist, Dr. Akanksha Chaudhary. They made one mouthwash using a plant that is as potent as Listerine, which is a mouthwash. But Listerine has potential molecules that are potential carcinogen, but that herbal mouthwash, Molsri or Mammosops elengi, that doesn't have that cancerous property. Okay, thank you, sir. That was my take.
Okay. In the end, we'll please answer your question. Now, Anubha is going to present. In the
Yes,
end,
sir.
we will answer your question.
Yes.
Yeah, Anubha, please start.
Okay, sir. So good morning, everyone. The topic today I'll be going further and discussing is a very important one, which is the prevention of dental caries. This forms a vital part of dental caries. So first of all, as we all know, prevention is to stop the disease before it has even occurred. So why do we need this prevention? So our primary goal of a caries prevention program is that we should reduce the number of cariogenic bacteria. So the karyogenicity of the bacteria, as it was very nicely discussed earlier by Dr. Alka, as she was telling earlier that whenever we have fermentable carbohydrates, the pH of a mouth will fall down.
Registration and submit up the songs.
So the pH of the mouth will fall below 5.5, and when
So please mute your mics. Please mute your mics. Okay.
yes, we discuss the need for prevention. Why do we need to prevent dental caries? So the first need is a very vital, is that caries can lead to severe pain. So this is what we want to prevent in the initial or the primary stage. Second is that the symptomatic treatment can be very extensive when the damage has been done and we need to do some damage control. So it requires treatments involving different parts.
1 minute. Can you all switch off your mobiles? Hello. Can you switch off your mobiles? Mute your mobiles. All right. Yes, please continue.
Yes. And the third need for prevention is that if we prevent the caries can also lead to dysfunctioning in speech, especially in our front teeth and the interior teeth, which are very important for our from an aesthetic point of view and also from a functional. So what do we need is that when we follow the prevention protocol, it will help in establishing a proper speech and mastication. It will help in chewing, and also it will help in maintaining the nutrition. Now, as we all know that in older patients, when there is a loss of tooth, their nutrition is also compromised. So our teeth are playing a very important role when it comes to nutrition. So the rehabilitation of teeth can be done with the help of prosthesis. And the last need is that the cost of treatment becomes very high. We do not prevent it at an early stage. So what we should be doing as a dental professional is that we can always advise the patient, or we can educate the masses that whenever we should visit a dentist, we should do it at periodic times. As we always say that always go and visit your dentist every 6 months, because anything which is present, any minor disease or caries which is present at that stage can be immediately treated, and it will not lead to any rehabilitation at the further stage. Now, when we talk about prevention, there are different levels of prevention. So there are 3 levels of prevention. So first is the primary level, secondary, and the tertiary level. So the primary level of prevention are the actions which will be taken prior to the onset of the disease. So this removes the possibility that the disease will ever occur. So this is the very important part. Now the dental caries has not occurred, but what can we do so that it does not occur in the future as well. So there are certain methods and certain materials which we can apply on the tooth, which I'll just describe to you in my later slides. The secondary prevention is that the case has already started, right? So it is in the incipient stage. So since it's already started, what actions we can take to halt the progress of the disease? So that comes under secondary prevention. So we need to prevent any complications. So what all measures can we take to prevent in the secondary stage? And the third stage is the tertiary stage. Now in this, we will take all the actions and measures which are available to reduce or limit the damage or the impairments which have already been done. So we'll try to rehabilitate the patient with prosthesis, which are available with us. We have many options: removable prosthesis, fixed prosthesis, or a dental implant. So we will minimize the suffering which has been caused by the existing departures from the good health. And we'll try to promote and we'll try to tell the patient that they have to make certain adjustments to the previous damage loss which has been done. So what we should try is that we should limit the disease in the primary stage only, rather than waiting for the pain to occur and leading it to further damage. So now these are the levels of prevention. This is a chart which is showing the different levels of prevention and the preventive services which can be undertaken. So whenever we talk about prevention, it can be divided into three parts. There are certain preventive services which can be taken up by the dental professional, but what can the society or the community do as a whole to prevent the dental caries? And thirdly is that, are there certain preventive measures which can be taken by the patient? So yes, there are. So when we talk about patients, what can patients do is that they can come for periodic visits to the dental office. So please visit your nearest dental office every 6 months. And you can demand for preventive services. You can ask your dental professional that I need some preventive services. So please describe to me or elaborate to me which services are available in your dental office or in your hospital. So the dentist, whoever is available at that time, they will explain that what services they are providing. And third is the diet planning. Diet planning plays a very important role when it comes to the patient. We always tell that we should reduce the sugar exposure. We start educating that whenever the child is very small, he's an infant, we try to educate the parents that from the very small age, start minimizing the exposure, the sugar exposure of your child. Because once he gets used to it, it is difficult for the parents as well as for us as a dental professional to stop the child from eating the sugar. So the diet counseling, any sugar substitutes that we can give, instead of eating sugar, we can go for sugar substitutes such as xylitol. We can ask the patient to have xylitol, a xylitol chewing gum, because they are non-cariogenic, right? They don't have any calories. They are non-caloric and non-cariogenic. So these are certain, we can tell the patient about certain diet substitutes that they can take. Instead of eating a sugary diet, we can give them certain substitutes, or we can tell them that we can either go for cheese. Like cheese is also non-cariogenic. It does not cause any bacteria. Or if a child is hungry, instead of giving him some chocolate or some sweets, we can tell them that the child can go for instead healthy options like nuts, peanuts, if the child has no allergy to any nuts. So we can advise them with certain substitutes when it comes to diet counseling. Now the services which can be provided by us. So what we can do is we can go for patient education. We can give you a diet counseling. We can keep you on a recall. We can keep calling you for follow-ups to see whether the treatment is working or whether the patient has any other clinical symptom or sign. And we can keep reinforcing that after every few weeks. Now, what can we do? What can we do as a community? See, the very important step for a community is to hold various programs like the one which is being held right now. It is a very, very important part of prevention, because this is one of the mediums through which we can educate the people from a small child to adults to older people. Then we can tell them, we can educate them that what preventive methods can be taken. So as a community, we should hold various programs, whether online or at starting from a lower level, starting from a village level. We can go and promote these programs. We can tell them about the various brushing techniques which can be followed, and oral hygienes which can be followed by children, by adults, which are different techniques. There are different techniques for children as well as for adults. So now starting with the preventive measures which can be taken by a dental professional. So the first one which I would like to introduce you is called as pit and fissure sealants. Now, as you can see in the photographs which have been provided, so the arrows which have been marked, these small pinpoint depressions and these small cracks which you can see in your molar teeth, your back teeth. So these are called as pit and fissures. So mostly these pit and fissures, they are always harboring with bacteria in the mouth. And these fissures, these pits, they form a very sheltered environment in which the dental caries can easily thrive. So what do? We have these sealants. This is a flowable material and which has a low viscosity. So these materials, they easily flow inside these small cracks and depressions. So as you can see in the next photo, we can see a white and opaque material which has been now been applied to the tooth. So this material, they are also fluoride releasing. So fluoride releasing, fluoride makes our tooth anti-carious. It is anti-cariogenic product. So whenever these sealants, they can be applied on the tooth. So what do? They obliterate the occlusal surfaces of the teeth, and they will stop the nutrient supply of the bacteria which is thriving inside these, pit and fissure. So that is what it can be easily done. Right. I'm sorry for the interruption. Right. So we can apply these sealants on the surface of the teeth, and they will cut the nutrient supply of all the bacteria. So in this way, we are preventing from caries ever occurring. So it is not necessary that we need to always drill the tooth and fill the material inside it. So what we can do is we can seal the tooth. So we can seal the tooth properly and we can save the tooth. So instead of going for a drill and save, we can seal the tooth and save. So that is the main concept of sealants. So these are certain brochures that we can keep in our clinics, in our hospitals, and we can distribute it also. So this is clearly showing that how these sealants are so effective in preventing dental caries. So we need to prevent it in the early stage before making it a progressive disease. So these are some of the banners that we keep it in our clinics and in our hospitals so that we can motivate the patient. Now, next are the topical fluorides. So these fluorides, the fluoride application can be done in two ways. That is in topical application and in the systemic application. Now, the topical application, topical means that we are applying these fluorides on the surface of the teeth. So they can be applied by a dental professional. So as you can see in this slide, we have foam trays which are present with us in the hospitals and in the clinics. So these foam trays, these fluorides are available in different forms. So they can be available in a gel form or in a foam form. So these fluorides can be applied in these trays. And what we'll do is we'll insert these trays inside the mouth of the patient. So we generally promote children because in the children, the teeth have newly erupted inside the mouth. So what we'll do is we'll insert these trays inside the mouth of the child for 3 to 4 minutes. right? And after 3 to 4 minutes, we'll ask the child to spit all the saliva which is present. So when we take it out, the application of fluorides has been done. So the enamel, which is the outermost surface of the tooth, that will imbibe all the fluoride which has been present in outside. So there are various fluorides which are available. So first is the sodium fluoride, other is the stannous fluoride. We can also apply fluoride in the form of a varnish. We can apply in the form of acidulated phosphate fluoride, which is also called as APF gel. So these fluorides can be applied onto the surface. And we always recommend that we should go for 2 applications in a year. So after every 6 months, we always tell the parents to bring their child to the clinic, especially when he's 6 to 7 years or 12 to 13 years, so that we can apply these fluorides. And they have been shown to reduce caries by 30 to 40% in various studies. So especially for a child who they have the habit of eating sugar and fermentable carbohydrates. So when we apply these fluorides, it can help a lot in the prevention of caries. Next is a very common tool which we are all using, that is our toothpaste, also called as dentrifices. So today, nowadays in the market, the fluoride dentrifices are easily available, whether we go for Colgate or any other company, because fluorides, they play a major role for decline in the dental caries in many parts of the world. So we as dental professionals would always recommend you to go for a fluoridated toothpaste, because they are the one of the most widely accepted method of topical application of fluoride. So the fluoride which is available in this is in the form of sodium monofluorophosphate. So these fluorides, they act as a source of supply of fluoride in the oral environment. So that is why if any caries is occurring, so these fluorides will help in accelerating the remineralization process. So they play a very Next are the mouth rinses. So the fluoride mouth rinses, in the same way that we were typing for a fluoridated toothpaste, in the same way we'll want to go for a fluoridated mouth rinse, because they are a very effective tool in preventing dental caries. And the dosage which can be available is that the patient can use it once daily. So we recommend 0.02% of sodium fluoride or 0.05% of sodium fluoride. So that can be done once daily. But if you want to use it only once a week, so we need to increase the concentration then. So then we will go for 0.2% sodium fluoride, right? So you can always check, you can always ask your dentist, and accordingly, according to your usage, he can prescribe you that which and how many times you should apply or you should use your mouth rinse. The indications for these mouth rinses is that we can prescribe these mouth rinses over the age of 6 years, right? Or any patient who, especially children who are wearing certain braces, or they have gone for a fixed therapy. So braces helps in the accumulation and harboring of plaque and bacteria. So for such patients, there are more chances of dental caries. So we prescribe these mouth rinses to such children or patients who are undergoing orthodontic treatment. We will we can also prescribe it to those patients who have a high tendency of caries. There are certain children, they are very caries prone, right? They have certain root caries or enamel caries. So for such patients, we can prescribe a mouthwash. And also for there are many adults, they undergo or they suffer from hypersensitivity in teeth. So for such patients, we always prescribe these mouthwashes so as to reduce their. So I would like to conclude by saying that prevention is always better than cure. So we as a dentist and should want to educate people, and we want to pay more emphasis on the preventive part rather than the treatment part, because there are a lot of dentists who are paying more attention on the treatment. But what I would like to say is that please pay more emphasis on the preventive part. So a lot of time, energy, and manpower can be saved if we pay more attention to the prevention. And also, we should try to identify and evaluate the factors for the importance of caries formation. And for the normal masses, or what we should try and educate it is, please keep visiting your dentist, ask him for preventive measures. They are always available at every dental office and every dental hospital. So it is always better that rather than waiting for the pain to occur and then visiting our dentist, which is always such a hassle for the patient as well. So this is what I would like to say in the end. Thank you so much. Now I would like to present the mic to our next speaker, Dr. Triclosan Singh, in which he will tell you elaborately about oral hygiene maintenance and diet.
Thank you, Dr. Anuba. A very good afternoon to all of you. So I am Dr. Jyotsna Singh, and today I'll be discussing oral hygiene maintenance and diet control. As the previous speakers have elaborated on what are the microbes which are causing caries and how caries can be prevented. So I think a very important and basic thing for all of us to know is that what are we doing as humans that is contributing to occurrence of decay in the first place. So for that, we first of all need to know that what are the habits which lead to caries.
Hello, can you please mute your mics, all of you? Can you mute your mics? Close your mics. Yes, Jyotsna, go ahead. Who is this person who is not muting?
May I continue, sir?
Yes, please. But somebody is not muting the mic. Somebody.
I request all the participants to kindly mute their mics. There is some noise in the background. Okay, so we'll continue.
Yes,
so
please.
I was talking,
Jyotsna, continue.
Yes. So basically, I was talking about that what are our basic habits as human beings which majorly contributes to occurrence of caries, or which we commonly call dental decay in the first place. So first habit that we have is binge eating on foods which are not good for us. Sweet items which stick to your oral cavity, then eating excessive junk food. And then the next important habit, which is a major contributor, is bad oral hygiene. Bad oral hygiene mainly results from factors like when a person is either unwilling to clean their oral cavity in the first place, or they are doing it in the wrong manner. As you can see on the screen, these are some pictures which are depicting signs of bad oral hygiene. So bad oral hygiene, most commonly, there are stains on the teeth, there are deposits on the teeth. The deposits can be plaque, and when that plaque later on hardens, it is called calculus. So these are the main signs. Apart from this, when a person starts developing bad breath, which we commonly call as halitosis, that is a major indicator that you need to change the way you're keeping your oral cavity clean, because that will only decide the fate of your oral hygiene and oral status in years to come. Now, all of us need to remember mainly 4 things. These 4 habits, if we are able to imbibe in our day-to-day life, then nothing can be better than that, and the visits to our dentist will definitely reduce by a lot. The first habit which we have to imbibe in our daily life is proper brushing of teeth. The second one is cleaning the tongue. The third one is flossing. A lot of us promise that we'll do it, but we don't actually do it. And the fourth and the most important one is eating a healthy, balanced diet. The first habit that I will talk about is brushing of teeth. Now we are all aware that we are supposed to be using dentifrices. Dentifrices are the mediums through which we brush our teeth, like a toothbrush or a tooth powder. Or there are some people in this country, in many parts, who actually use just a neem stick for chewing to keep their oral cavity clean. Now, whichever method you plan to adopt, that is fine. But the right way of adopting is very important. If we talk about brushing of teeth, the right amount of toothpaste, the right kind of brush, and the right duration and the right frequency of brushing are the most important factors. Ideally, a person should be taking a pea-sized amount of toothpaste on their toothbrush. Pea size is like a small dollop of toothpaste. And then the brush that they're using should ideally be a very soft brush. Now, brushes come in different kinds of consistencies. The bristles can be coarse, they can be medium coarse, they can be soft, and then they can be ultra soft. So, depending upon the needs of the patient, what kind of other existing problems they have, or if they don't have any, and the age of the patient, we usually tell that what kind of brush is good for them. So for children, we always prescribe an ultra soft brush because their gums are more sensitive. So sometimes when a child is rigorously brushing, they can damage their gums. On the other hand, we have adults also who tend to have a tendency of brushing for more than 2 to 3 minutes, and they end up causing more damage than preventing any further disease. So using a soft toothbrush, a dollop or a pea-sized amount of toothpaste, brushing for only 2 to 3 minutes, and brushing twice. These are the 4 important factors which you always have to keep in mind. So for children, as I discussed, an ultra soft or soft toothbrush, duration 2 to 3 minutes. And the manner of brushing, again, is very important. It is highly important that all of us know today that the worst kind of brushing technique which people usually tend to adopt is the technique where they move their toothbrush from side to side, that is from left to right, in a rigorous fashion. Now, the problem that happens is that it leads to a condition which is known as abrasion of teeth. Abrasion is what? That the outermost layer of your teeth, the enamel, it starts eroding away. It starts abrading away, and abrasion, because of abrasion, people tend to develop another condition which is called sensitivity, as most of us complain of having sensitivity to either cold food or something hot to drink. So to prevent that from happening, it is important that you use the right kind of stroke. Children usually should be using circular strokes for brushing, whereas for adults, we advise that the adults first of all place the 45-degree angle. Half of the surface should be on the tooth, half of it should be on the gum, and they move the toothbrush in a first of all a vertical direction, that is from up to down. A vertical direction, they should clean all the sides of their teeth on the outer surface. Then they should move the toothbrush on the inner surfaces of their teeth and make sure that all the inner surfaces of their upper and lower teeth are properly cleaned, and they rinse them out after they brush. After toothbrushing, the person should move on to the next thing, which is cleaning of tongue, because the tongue harbors a lot of microbes which are left over from the food that you eat the previous day or whatever meal you've had last. So it is highly important that a person uses tongue cleaners. Tongue cleaners usually are available in different materials. You have plastic cleaners, you have steel, you have metallic tongue cleaners. So as per your convenience and what you can afford and what you think is good, there are different brands marketing tongue cleaners. So based on your own discretion, you can choose your tongue cleaner and definitely do tongue cleaning after you brush. The third important thing is flossing. Flossing is nothing but cleaning your interdental, that is the area which is present between two teeth. That is where mostly all the food gets stuck, and that further on causes problem like pain and sensitivity, and later on it can cause caries or decay also in the same region if food keeps getting lodged in the same area again and again. The right method of flossing, first of all, flosses are of many kinds. Again, you have waxed flosses, you have unwaxed flosses. Now some companies, they market a spool of floss, like it is an entire box which has like a complete it is a spool, something like a normal thread. It looks like a thread. So you keep taking out some amount, some length for one usage, and then you just keep the box back. Apart from that, there are some companies which market one-time usage floss. They're basically a plastic. They have a plastic handle, and already there is a piece of floss attached to the plastic handle. So you just need to take out one piece at a time and use that floss and throw it away. I personally recommend that we buy a spool of floss rather than the pre-made ones, because the spool can, when you have a spool of floss, you take out a piece of floss and then you can easily manipulate it by your own hands using your own fingers as the handle. So that is the advantage. This picture, which is right now displayed in front of you, it depicts that ideally how one should be flossing. So the first step is you are supposed to wrap the floss around your middle fingers. Then you pinch the floss between your thumbs and index fingers, and you leave a space of about 1 to 2 inches in between. And then you gently guide that floss between each interdental area using a saw-like motion. Saw-like motion means that back and front. Moving it back and forth, you adapt it in the interdental area, and then again in that saw-like motion, you bring it towards or away from the tooth or the interdental area towards your oral cavity. In this manner, whatever is stuck, if there is plaque, if there is debris, if there is calculus, if there is food item, anything that is stuck, that will easily come out. This habit looks, flossing looks a little difficult. It looks like you need to be very dexterous for it, but that is not so. If you start doing it once and you imbibe it in your day-to-day life, it can take you a long way. Now coming to the next aspect, which has a major contribution and first of all occurrence of dental decay, is the kind of food that we are consuming every day. This is a list showing cariogenic foods, meaning the foods which cause caries, and then the foods which are not caries causing and which one should consume more in their daily diet. So most commonly sugar and chocolate confectionery, like chocolates and biscuits, then cakes, then jams and jellies, ice cream, fruit syrup, anything sugary for that matter, whether it is in a powder form or a liquid form or in a solid form. Then sugared soft drinks, which is everyone's favorite, especially children. Then flavored and sweetened milk, buns, pastries, pies, puddings, and breakfast cereals. So these are some of the foods which are caries causing. Especially as Indians, we tend to consume sugar more. We come from a land which is famous for Indian sweets. Mithai is everyone's favorite. But it is important that we control our intake. And in case we are eating something sweet also, we have to make sure that we brush, clean our tongue, floss, and keep rinsing our mouth once we are done with that. Now, the other kind of food which is not caries causing, which is actually healthy for you, those include bread, sandwiches, toast, pasta, rice, then unsweetened yogurt, low sugar breakfast cereals, then sugar-free confectionery, fresh fruits. Fresh fruits and green leafy vegetables, definitely the best option for us. Then water, yes, one must consume loads and loads of water for all, not just your teeth, but in general for your body also. For general health, water is a must. Then dairy products like milk and cheese and drinks which do not contain sugar, which are either naturally sweetened, they are also good for you. We have to avoid everything which is depicted in this picture right now. Junk foods like French fries and burgers, anything which contains preservatives like sauces. Then sweet products which have an excessive amount of sugar, like you have bakery items like chocolate muffins and donuts and sugary soft drinks or ice creams. We must try to avoid them as much as we can. In order to lead a healthy life, in order to have a good oral hygiene, it is very important for us to maintain a balanced diet. So this is a food pyramid which is depicting that what we should be eating less, what we should be eating moderately, what should contribute to majority of a diet, and what should we be eating the most in order to have a balanced diet. So as you can all see, we should be eating less of fat, oil, sugar, and salt. Then we should be moderately consuming dairy products and meat products. We should eat more of fruits and most cereals and whole grains. They have the most positive effect on our body. So we should try to imbibe that, incorporate that in our diet. Apart from this, it is highly important that we drink up to 6 to 8 glasses of fluid, which can be water or weak tea, that is not strong tea, and soup every day. So with this, I would like to conclude by saying that a healthy mouth is a window to overall health. So if we brush correctly and eat in a mindful manner, we can prevent ourselves from falling victim to the most common disease, which is dental decay or dental caries.
So your talk is over, Jyotsna?
Yes, sir. So on behalf of everyone, I would like to extend a vote of thanks also.
Yes. Before that, Jyotsna,
yes, sir.
if anybody has got a question, he can ask.
Yes, sir. Yes, sir.
Any questions? Okay, you can give the vote of thanks.
Okay.
So can I ask one question, please? I'm from Nepal.
Yes.
I'm Professor Anjana Singh. And first of all, I would like to thank for a wonderful a webinar that has been organized today. And Dr. Jyotsna, I have one question is for you. Did you happen to come across with any diabetic persons while you are working with this dental caries?
Yes, ma'am. I have.
Hello?
Yes, ma'am, I have. What's your query?
Okay. What was the cases in case of patients with the diabetes in compared to normal ones? Is there any different microorganisms they were harboring there?
Ma'am, the cases that I have come across who have diabetes and who have dental caries, so ma'am, most commonly microbiologically, ma'am, I have not really come across anything different because probably I'm a public health person, so I have not checked. But clinically, yes, there is a difference. Clinically, there is difference because, ma'am, first of all, since the rate of healing is slower in diabetic patients, and in general, their body's immunity is a little. The immunology also changes because of the systemic condition. So, because of that, there are patients who have rampant caries who are diabetics. So although there is a misconception that sugar is the main causative factor behind diabetes, that is not so. But in general, we as dentists always advise them that they should try to control their sugar intake as much as possible so that it does not harm their oral health status.
Okay, thank you, ma'am. Thank you.
And Jyotsna, what about the healing in case of diabetic people?
So yes, sir. So in case of diabetic patients, the main problem we face is the healing part. But so in terms of dental caries, because most of the procedures that we do are not invasive in nature, like restorations which are done, there is no bleeding as such. So for those patients, we don't see much of a difference. But yes, if we are doing a surgical procedure, for example, we are doing a periodontal surgery where we are treating the gums surgically, or if we have to extract a tooth for someone whose entire tooth is decayed, for them we have to take few extra precautions because the healing of the socket, that is the space which is created after removing the tooth, that healing takes more time because the patient is already in an immunocompromised state.
Yes.
So we have to keep a check. So in those patients, we usually use local antiseptics. Then we keep recalling them if we see that the bleeding has not stopped. Then we give figure of 8 sutures, and there are many other procedures by which we make sure that the patient's healing is not hampered.
Very good. Thank you. And Dr. Anjana, you are from Kathmandu? Dr. Anjana?
Yes, Dr. Singh.
Are you from Kathmandu?
Yes, I'm from Tribhuvan University,
I see.
from Central Department of Microbiology. That's why my interest was in microbiology, so I asked the question. Anyway,
I was working in Institute of Microbial Technology in Chandigarh. A delegation had come from Nepal. Were you also in the team when you came?
Pardon, sir. In between, I didn't hear you. What were you saying?
I'm saying that a delegation from Nepal had come to Chandigarh, Institute of Microbial Technology, IMTech.
Okay.
Were you in the delegation?
No, I was not in the delegation, and most probably these are from the. Hello?
Okay. Hello, yes, I can hear you.
From the hospital, but I am from the basic science.
All right, all right. I thought maybe you had come in that delegation.
No, I didn't. Thank you.
Now you can give the word of thanks.
Sir, I'd just like to add one more to ma'am's question that she had asked. Actually, sir, in general, any patient who has dental caries, microbiologically, there is no difference even in different systemic conditions, like diabetes, for example. The thing that changes is the response of the host because there is an immunocompromised state. But apart from that, we don't see anything different.
Oh, thank you.
Thank you.
With this, we would like to conclude this session, and I would like to extend a vote of thanks to Dr. Swaranjit and Dr. Deshmukh for organizing this wonderful session with which we could bring forward so many new knowledge factors and points to all of you. And I hope that we were able to answer most of the questions. I would also like to extend my vote of thanks to Dr. Vimal Kalia, Principal, Rayat Bahara Dental College, Dr. Neena, Dean, Academic Affairs, Rayat Bahara University, and also Dr. Mandeep for coordinating the entire series of events. Thank you, sir.
All four of you did a wonderful job today. We are more wiser in dental microbiology. We have come to know what is good for our mouth, what is not good, what food is good for our teeth. We have come to know so many things. And toothpastes have got probiotic microbes like Lactobacillus, Streptococcus thermophilus, which grows at 45 degrees centigrade. It's a thermophilic strain. So the name is Streptococcus thermophilus. Then we have many other strains which are good, which are beneficial microbiomes. You know, microbiomes, they are on our skin, they are on our face, and the microbiomes protect our body from the pathogens. Even in our mouth, the oral cavity, we have beneficial microbiomes. These microbiomes kill the pathogens which are there in the mouth, on the teeth, on the tongue. So we have to propagate the microbiome which is beneficial and kill the pathogens. We should not use chemicals. I told you about one chemical which is very bad for our system, that is triclosan. Triclosan actually does not make the antibiotics effective. It is a very bad chemical. So we should promote microbial diversity. We should promote preservation and conservation of microbiome. Thank you very much, all of you, all four of you. Thank you. So we conclude today's session. Thanks so much.
Thank you so much, sir. Thank you so much.
Thank you, sir.